This is actually a great question. If you have a darker skin tone, if you're a black person, do you actually need sunscreen? The answer may surprise you. Let's go over it. People with darker skin tones have more melanin. They have more natural protection from the sun, and they may not even burn at all. If you do not burn, if you do not tan, you don't really need a sunscreen, at least for that purpose. And the rate of UV induced skin cancer in people with darker skin tones is way lower compared to our lighter skin counterparts. One of my awesome attendings from residency, Dr. Ade Adamson, has spoken a lot about this. The rates of UV induced skin cancer in people of color is a lot less. And I've actually been involved in one of his studies showing this. So, if you have a dark skin tone, you don't really get tan, you don't burn, you may not need a sunscreen at all. But if you have a light sensitive, UV sensitive condition, you may want to use the sunscreen. If you have something like melasma, if you have lupus, if you have dermatomyositis, if you have polymorphous light eruption, these are all conditions that are worsened by UV exposure, and sunscreen can help protect you from those conditions worsening or developing. And even if you may not burn and your risk of skin cancer is quite low, you still may tan, your skin may darken from chronic sun exposure, and that can lead to uneven pigmentation, especially if you're wearing a t-shirt all the time. You'll have a permanent farmer's tan. So those are reasons you may want to wear a sunscreen, but it's not an absolute necessity as it is for my paler skin patients and friends. And then, of course, chronic UV exposure can make you look older, can kind of increase the amount of wrinkles that you get. Obviously, again, you're more protected if you have more melanin, if your skin is darker, but it's not absolutely zero. But this just makes simple sense, right? My paler patients, I'm going to be like, you guys got to wear sunscreen all the time, versus my patients with much darker skin tones, I'm not going to be as aggressive as telling them to wear sunscreen all the time because their risk is lower. But this is not the same as getting a tan. And a tan only has an SPF of maybe 2 to 4. That is not the same thing. And you tanning your skin is actually causing damage. So, no, that is not the same. If you are pale and you get a tan, it is not the same as just having genetically darker skin. Sorry, I came back to say two quick things. Number one, go follow Dr. Adamson. He's currently only on Instagram right now, but we need to encourage him to come on to TikTok because he's got to join the conversation. And the second thing is, I don't know if you specifically should wear sunscreen. That's an individual decision that you should make on your own. If you want to defer to the safest option, wear the sunscreen. But as you can see, there's some nuance to it.